What is diabetic retinopathy? Diabetic retinopathy is an eye condition that can occur in people with diabetes, either type 1 or 2 diabetes, and happens when high blood sugar levels over time damage the small blood vessels in the eye, specifically the retina. The retina is the light-sensitive tissue at the back of the eye that ultimately connects to the brain. Now, over time, this damage can lead to vision problems and even blindness if not managed properly. There are two main stages of diabetic retinopathy. You have non-proliferative diabetic retinopathy, a less severe form, and you have the more severe proliferative diabetic retinopathy. Let's talk about non-proliferative diabetic retinopathy. In the early stages, damaged blood vessels may leak fluid or blood into the retina, causing the retina to swell and causing hemorrhages in the retina. This can lead to blurred vision. Small bulges in the retina called microaneurysms may form. Deposits of fat or proteins may also occur in the retina. These are all under the category of non-proliferative diabetic retinopathy, which usually just requires monitoring by the ophthalmologist. Number two, the more severe form of diabetic retinopathy is proliferative diabetic retinopathy. This is a more advanced stage where the retina responds to damage by growing new abnormal blood vessels. Now, these vessels are fragile and can bleed into the retina, causing severe vision loss or blindness. Scar tissue from this process can pool on the retina, leading to retinal detachments. What are some of the symptoms of diabetic retinopathy? You may not notice symptoms in the early stages, but as the condition matures, you might experience blurred vision, fluctuating vision, dark or empty spots in your field of vision, difficulty seeing in nighttime conditions, and in more severe cases, sudden loss of vision. Let's talk about some of the treatment options for diabetic retinopathy. The treatment will depend on the severity of your condition, as determined by your ophthalmologist. The aims and goals of treatment are to prevent further loss of vision. Some of the options include blood sugar and blood pressure management by your general medical doctor. Controlling diabetes, maintaining healthy blood pressure is the foundation of preventing and slowing diabetic retinopathy in its early stages. In more severe forms, where there has been swelling and bleeding in the retina, your ophthalmologist and retina specialist may decide to treat you in the office. Injections into the eye of medications such as Avastin, Lucentis, Eylea, Vabysmo, these are injected into the eye after your eye has been numbed by medication. Other options for treatment include laser. Laser is used to seal leaking blood vessels and reduce the growth of new ones. These can stabilize vision and prevent further damage. And again, often these are done in the office of your provider. In more advanced cases, vitrectomy surgery may be necessary. Vitrectomy surgery involves removing the gel-like fluid in the eye called vitreous and replacing it with a clear solution. Let's talk about the importance of regular eye exams. Now, because diabetic retinopathy often starts without symptoms, regular eye checkups are crucial, either yearly exams or even more often as determined by your ophthalmologist. If you have any concerns or notice changes in your vision, please reach out to us and we can help. Thank you.